Welcome back. Ontario's doctors are close to getting a new compensation deal that aims to address the long-standing shortage of physicians in family medicine in this province.
For the details, let's go live to CP24's Lindsay Biscaia. Lindsay.
Yeah, and this deal really is, the idea behind it is to attract more physicians to the field, because obviously Ontario has been struggling for years now when it comes to the number of family doctors it needs versus the number of family doctors it actually has. So this is a deal being worked out between the province of Ontario and the Ontario Medical Association, and it's close to being finalized, so it's not quite done yet. It would basically update the compensation model for doctors who are working in family health to pay them more. That has been part of the struggle over the years. A lot of family doctors are doing administrative and paperwork on their own time and not being paid for it, and also, you know, having really long appointments with some patients that have a lot of complications and not feeling as though they are adequately compensated for that. So this would be the first revamp in their payment structure in 20 years. And again, really aimed at getting doctors, the pay that they deserve for the additional work that they have to do. We did speak with the OMA CEO today about this deal and the kinks that kind of still need to be worked out in it. Here's more from the CEO.
We've come to agreement with the ministry on probably some of the key points, and that is that physicians are going to be compensated for the time they're spending, the extra time that they're spending on clinical administration. We've heard from family doctors all over the province who have said that the amount of administration they're doing is skyrocketing. And, you know, they didn't go to medical school to do that. They went to medical school because they want to treat patients. And so it's good that they'll be compensated for that. And at the same time, we're looking at ways to reduce that administration, but at least they will be compensated for it.
So this is also part of the province's plan, Lindsay Biscaia, to have every Ontarian have a family doctor by the year 2029. So this is starting that, really trying to get more doctors back into Ontario, because we also know a lot of them have gone south of the border to find work that is actually comparable to how they feel they should be paid as well. We did hear from Ontario's Health Minister Sylvia Jones about this deal and the goals that Ontario has in the future in terms of healthcare. Here's more from the minister.
We made another round of announcements in June of this year. Again, lots of excitement across Ontario in communities that put forward proposals and now have the financial support from the provincial government to get those teams operationalized. There will be another call for proposals, applications in September of this year. So as we expand primary care clinicians, opportunities in communities, we want to make sure that those physicians, those clinicians, those nurse practitioners are well supported, and we're doing that work with the OMA.
So again, Lindsay Biscaia, this deal is not finalized yet, but the OMA did tell us today that they're hoping that a deal will be finalized by spring of 2026. So just a couple of months away, really, at this point. Back to you.
Okay, reporting live, CP24's Lindsay Biscaia. Lindsay, thank you.